Tonight is our second session in this series, and it will touch on the importance of knowing when to use opioids and associated treatment effects. During this session, we will learn what an opioid is, the difference between dependence and tolerance, how to identify misuse patterns, the importance of safe disposal and countermeasures, and how stigmas can impact treatment outcomes. The session will also address how opioids impact the community and the family unit. We're happy to have Dr. Natasha Seals from the Louisiana Department of Health joining us tonight to present about this very important topic. Natasha is a pharmacist that works with Louisiana Department of Health's Overdose Data to Action Grant, and her primary role is to serve as opioid pharmacist educator and coordinator. Natasha also assists with COVID-19 vaccination planning and emergency operations for the Louisiana Department of Health. As time permits, Natasha serves the public as a community retail pharmacist. She is a graduate of Xavier University of Louisiana and resides in Baton Rouge. Natasha, we're looking forward to hearing from you, and thank you for joining us. I'll go ahead and turn it over to you now.
Thank you so much for having me, and I am so glad to be with you tonight. Could we go to the first slide?
Yes, I'm working on that, right?
Okie dokie. And as she's pulling it up, as stated, my name is Natasha. I'm a pharmacist by trade. I work for the Louisiana Department of Health, and I'm based out of the Bureau of Community Preparedness. And tonight, my goal is to have a discussion with everyone that is on, that's present tonight. And I want to encourage you to participate, because the more you participate, I think the more that you retain and you get from this particular conversation. I would like for it to be a discussion and not a monologue. So when I ask for you to participate, please do so, or I'll just scroll through chat and pick a random name and say, hey, like you're in class, can you answer this question for me, please? Next slide. So our objectives for tonight, we're going to recall national and state opioid stats, understand when to use opioids and the associated side effects, the difference between dependence, tolerance, and addiction, identify misuse patterns and safe disposal options, available countermeasures and the importance of using them. We're going to talk about how stigmas can impact treatment outcomes. And last but not least, how opioids impact the community and the family unit. Next slide. So here we're going to take a brief moment to look at the 2019 national data. And I share with you 2019 because this is what is considered to be confirmed at this time. There's other information out there, but all of that at this time is still being considered to be preliminary data. So as regards to 2019, there are more than 72,000 individuals that died of a drug overdose death in the US. 74% of those drug overdose deaths involved opioids. More than 73% of those deaths included a synthetic opioid, such as fentanyl. Fentanyl has had a 14-fold increase in deaths between the time of 2012 and 2019. On average, 130 Americans die every day from an opioid overdose. A bit of historical relevance as it relates to our opioid epidemic crisis. It began seeing things about in the past 3 decades. First in 1990 due to increased prescribing. So this is a particular era of time where providers were being encouraged to write more prescriptions because it was really correlating to how they were being paid. Second in 2010 due to heroin. And third in 2013 due to something called IMF, or illegally manufactured fentanyl. All of these combined together contributed to the US Department of Health and Human Services declaring a public health emergency. Next slide. So here we take a specific look at our state in general and what it looks like in Louisiana. So for the year of 2019, there were 588 opioid-involved deaths. This correlates to a 25% increase between the time of 2018 and 2019. Overall, between 2012 and 2019, there was a 267% increase in opioid-involved deaths. As it relates to Louisiana, fentanyl deaths are greater, and contribute to more deaths than both heroin and prescription opioids combined. Next slide, please. Here we look at our 2018 and 2019 data for Louisiana. So as you can see, there were 1,486 drug-involved deaths during 2019. This correlates with an 11% increase from 2018 to 2019, and they are still on the rise. Louisiana averages about 81 prescriptions for opioids per 100 people during the year of 2019. Now, this number is actually decreasing from the preceding years. However, Louisiana still ranks high as compared to the national average. There were 13,890 drug poisoning related emergency department visits. Preliminary data for 2020 as it relates to emergency department visits also says that there has been a consistent increase in all drug-related harms, as well as opioids, as well as heroin. So that problem still persists. What I do want you to take away from this slide is that I said prescribing patterns such as the opioids are actually going down over time. However, our drug involved deaths are going up. So that should tell you something, that the problem doesn't just come from prescriptions, it's coming from other means, such as illegally manufactured fentanyl or illicit substances. Next slide, please. So over the next two slides, we're going to look at 2020 preliminary overdose data that was released by the CDC Health Advisory. Many people asked, did 2020 and all the things that happened have an effect on the opioid epidemic? And if so, what happened and to what degree? Thus far, it has been stated that there was an increase in fatal overdoses associated with synthetic opioids. This data was collected between or before and during COVID-19, with the 12 months ending in May of 2020. Provisional data says that there were over 81,000 drug overdoses during this time. This is the highest number ever recorded in a 12-month period. Most of these overdoses occurred between March of 2020 and May of 2020, which, as most of you know, coincides with the implementation of the stay-at-home order. This is important because it kind of confirms some of the things that we know about overdose deaths. With that implementation of the stay-at-home order, you saw isolation. With isolation, you see increased drug use. And with increased drug use, you would then have, unfortunately, increased overdose risk. Next slide. So while the deaths were already increasing in the months preceding COVID-19, this information does suggest that the pandemic did play a role. So as you can see on this slide, it reaffirms that synthetic opioids were a primary cause. 37 of the 38 jurisdictions with available data reported an increase in synthetic opioid involved deaths. 18 of those jurisdictions reported increases of greater than 50%. It's also important to note that as it relates to cocaine, those deaths also increased by a rate of about 26.5%. And based off of earlier research, this is said to probably be due to the use of cocaine with substances such as fentanyl or heroin. Next slide, please. So here we're going to look at understanding pain in all of its many layers. And I like to do this because as we talk about opioids, we need to dissect it from grassroots up. What are we treating? What are all the different options that we have? In order to be very well versed and well-rounded, we need to talk about all of these things. So according to IASP, which is the International Association for the Study of Pain, it defines pain as follows: an unpleasant sensory and emotional experience associated with or resembling that associated with actual or potential tissue damage. It's important to note that in 2020, there was a revision made to include or resembling that associated with, because it was recognized that pain is a personal experience that is influenced by many varying degrees of either biological, psychological, or social factors. The concept of pain is a learned experience over time through life experiences. The report of pain should be both respected as well as treated responsibly. Understanding pain and how it is treated is key to educating yourself and your family on safer opioid use. Next slide. So here we look at acute pain versus chronic pain. I don't know where these little marks is coming from. I apologize. We're getting some little markups, but you still can hear me just the same. So here we look at acute pain versus chronic pain. So CDC actually recognizes that when you treat acute pain, it should be done in the period of 3 to 7 days. Now, there may be instances where you may have to do more than that, but for the most part, 3 to 7 days should get the job done. It's generally caused by an event such as surgery, injury, or soft tissue damage. This particular pain serves a purpose. It warns you that something has happened to your body. It can last as little as a few days, some weeks, but for the most part, it should be done in a matter of months, maybe 3 to 6 months. It typically resolves when the cause of the pain has healed. So for acute pain, the focus is on treatment. But now let's pivot and talk about chronic pain. Chronic pain focuses on self-management and improved function. You see this type of chronic pain with things such as neuropathic pain or what we call maladaptive because sometimes it's unexplainable. It may not be associated with any actual injury or disease. Your scans can be clear when you go into the doctor. It does not serve a purpose, as in it's not warning your body that something has happened. It typically persists beyond the normal healing time of an injury with no foreseeable endpoint. So again, the focus is on self-management. With chronic pain, you can have things or causes that can be completely unexplainable. It can be a change in the weather that can make your pain worse, which is something called hyperalgesia. So, allodynia. So you have to be careful with things like that. Responsible prescribing is key. And we have to remember that addiction can happen in as little as 5 days. Next slide, please. So here we look at the different methods of pain relief. And there are several of them. Things like exercise, physical and occupational therapy. You have massage and meditation. So with meditation, this activates and reinforces some areas of the brain that is involved in pain processing. The thought is that if you decrease stress, you decrease pain. You can also use things such as muscle rubs, which is menthol or methylsalicylate, and these are served as counter irritants. So what happens is it causes your skin to cool and then become warm. This distracts from pain that is often associated with deep muscle pain. You also have things such as heat and cold therapy. So with the hot therapy, it improves circulation and blood flow, which in turn helps increase muscle flexibility. But on the opposite side with cold, it reduces blood flow, resulting in a decrease in inflammation and swelling. And this works especially well in places like joint and tendon areas. You can also use things such as acupuncture, aquatic therapy, something called CBT or cognitive behavioral therapy, as well as electrical stimulation in the form of TENS. There are also other options that are available for us to use, such as aspirin, acetaminophen, which is also branded as Tylenol, ibuprofen or Motrin, Aleve, also known as naproxen. And then you can have going to some prescription medications, such as anti-inflammatories, muscle relaxants, and nerve pills. Next slide, please. So here we take a look at our step therapy of care. This step therapy of care was designed by WHO, which is the World Health Care Organization. And it's simply saying that there should be a stepped process in treating your pain. You add on with each level of intensity. So with mild pain, the focus is to use non-opioid plus adjuvants. Those non-opioids, as I said earlier, are things like Tylenol or Aleve, in addition to those adjuvants, and sometimes that can be something as simple as an antidepressant. When you go to step 2, you're now at mild to moderate pain. And this can be treated by those same things from step 1, but you're going to add something such as a weak opioid, such as codeine, or I'm not going to say weak or weaker is a better term, codeine or tramadol or hydrocodone. And when those things don't work, we go to step 3 when we have moderate to severe pain. So now you're adding on or switching to those stronger opioids such as methadone, fentanyl, and oxycodone. The most important takeaway from this slide is you start at step one. And at step one, you can see opioids are not the first line of treatment for pain. You do not start there. So whenever you're going in for whatever your particular ailment may be, make sure you let your doctor know that you're also educated on the subject matter. And if you don't want an opioid, you don't have to start there. You can always go there later on, but start with something else. Next slide. So now let's talk about what is an opioid. So we've talked about pain, and we've talked about some other measures that we can use to treat our pain. But now we're going to talk about those people that actually have the moderate to severe pain. So it's a class of drugs used to treat pain relief. They occur both naturally in nature as well as synthetic. So naturally, you will find them in nature, such as a poppy plant. You can extract substances such as morphine and codeine from those plants. You also have something called endogenous opioids, which is those that are found in your body. Those are substances called enkephalins or endorphins. And endorphins are those things that give you that natural high like when you get from exercise. And also on the other side, we have our synthetics. They can be either semi-synthetic or fully synthetic, with your semis being stuff like hydrocodone or hydromorphone, or even heroin. And then with fully synthetic, you have things like fentanyl, methadone, and tramadol. They can be either legal or illegal. They treat, as I said, moderate to severe pain. And the actions are all over in your brain, in the digestive tract, the spinal cord, limbs, and organs. And I like to tell you this because people will take medication and think, well, hey, I have pain in my shoulder or wherever the problem may be. And perhaps it may only work there. But unfortunately, that is not the case. That is why we have side effects of opioids, because it's working all over your body. So you're not going to just have effects wherever the pain may be. You're going to have some other areas as well. Opioids can be addictive. They can cause dependence. And last but not least, they can also cause you to develop a tolerance. Next slide. So here are our common types of opioids. We have Norco, which has continued to be over the past few years the most commonly prescribed drug in Louisiana. We have OxyContin, tramadol, fentanyl, and you have a little image of the description of fentanyl on this slide, codeine, morphine, and heroin. So for heroin, it is 2 to 5 times stronger than morphine. Fentanyl, based off the dosage and how long you've been using it, can be anywhere from 50 to 100 times stronger than morphine. What I did not list on this slide is something called carfentanil. Now, this is something that is very, very strong. It is 100 times stronger than fentanyl and 10,000 times stronger than morphine. It is essentially a tranquilizer used for elephants. It's something that's very, very strong. You probably have seen it mentioned in the news lately through various parishes. I know in the last couple of years, there were reports of it being seen maybe in St. Martin Parish, as well as Jefferson Parish, and sometimes in northern parishes of the state as well. It is sometimes referred to as gray matter or gray death, I apologize. And this is because they take carfentanil and mix it with things such as fentanyl or heroin to have even more of an effect. It resembles a powdered cocaine substance, and it can either be snorted, be taken orally, or used IV. Because it is just that strong, the deaths unfortunately can happen not only in opioid naive, but in opioid tolerant patients as well. Next slide. So now let's look at some of the effects of opioids. And it's just a brief refresher. You have your drowsiness, nausea, constipation. So remember, it's not just working in the place where the pain is. It's also working in your digestive tract. So you're going to see things like constipation and urinary retention. It works in your brain and your spinal cord. So now in comes the euphoria and those happy feelings and confusion. It causes slow breathing. It causes respiratory depression, which is a great concern for us. Respiratory depression actually the risk can be increased if you have suffered from a stroke, you are a COPD patient, you have problems with sleep apnea or obesity. All those things contribute to your risk of respiratory depression. And last but not least, it can cause increased pain sensitivity. And this is like a tricky little thing right here, because as you're treated more with those chronic pain pills, it increases your chance to have increased pain sensitivity. So it's almost like you're kind of caught in a catch-22. You don't know what to do. And the importance of this is making sure that when you're having those conversations with your providers, that you're letting them know that you want them to treat your pain according to guidelines and do appropriate tapering, so you will be less likely to get to the point of having increased pain sensitivity. Next slide. So here, I wanted to pause and share some of those potential benefits from opioid alternatives. There are so many things that we can do before we get to taking opioids. And this focuses on those non-pharmaceutical options. And we're just going to take a moment to look at a few of them. Now, exercise is something that is absolutely fantastic. Most of us, myself included, can probably stand and lose a pound or two. And exercise is actually good for that. But there are also other benefits, such as decreased cardiovascular risk, increased energy, decreased stress, improved sleep and mood, and it also lowers your diabetes risk. So when you tell this to someone or share it with your friends and family members, my question would be, why wouldn't you at least give it a try? It can't hurt. Weight loss helps, as well as sleep hygiene, massage. Those mind-body therapies really help. And that's just essentially teaching your brain how to think when it comes to pain. Something about myself. I have horrible dental experiences. I just went through one maybe 2 or 3 weeks ago. Because sometimes with pain, you can have catastrophizing tendencies that contributes to the likelihood of you having chronic pain. So I'm already going in with a heightened sense of awareness because of my past experiences. Remember, I said it's contributed to life experiences. So now I'm predisposing myself almost mentally to what's going to happen with my pain. Last but not least, smoking cessation is a very big plus. And so what happens with smoking cessation, you have vasoconstriction. So you have this vessel that's tightening up, that's vasoconstriction. That's the easiest way to put it. And then that decreases the amount of blood flow coming through that vessel. When you remove the smoking, you're getting less vasoconstriction. Therefore, you're getting increased blood flow. And because of this, your pain should be helped. It should help the alleviation of your pain. Next slide, please. So now is the time where I said earlier that I want my audience to participate, because I can give you a whole lot of information, but it's always better to make sure that I know you're picking up, as they say, when I'm dropping down for you to pick up. So on the next slide, if you wouldn't mind going to it, I have a few questions. I would like for you to participate, and you can feel free to unmute yourself, because it's a very intimate audience. And we can give yourself a chance to say what you've learned thus far in the presentation. So give us a second to get the slide back up, and we're going to go into that screen where it shows those particular questions. Mandy?
Yes, sorry, working on it.
That's okay. All right, I just want to make sure you knew it wasn't showing. That's okay. I'm not in any hurry at all.
Here we are. Are we
Cool.
good?
Thank you. So our first question, do opioids occur naturally in nature? Feel free to unmute yourself. It can be anyone on this panel to provide the answer, because maybe someone may be shy and they don't want to speak up. You know, it just takes one person to get the conversation started. So do opioids occur naturally in nature?
Yes, they do. The poppy plant is an example.
Thank you. Number 2, the number of opioid-involved deaths in Louisiana during 2019.
841.
So not quite. So in 2019, for Louisiana specifically, there were 588.
Okay.
But thank you for participating. It took a wrong answer for us to get the right answer. Number 3, what type of opioid appears to have contributed most to the 2020 surge in fatal drug overdose deaths?
Fentanyl.
Fentanyl.
That is correct. Synthetic opioids or fentanyl. Either one of those answers will do. Number 4, now on this particular question, I want more than one person to provide an answer if you wouldn't mind, because there are several options. Can you name at least one opioid side effect?
Nausea.
Constipation.
All right, sounds good. Anyone else want to contribute?
Drowsiness.
Thank you. All right, for number 5, can you name a non-opioid as well as a non-pharmaceutical alternative used to treat pain?
Massage therapy. Massage therapy.
All right, what else do we have? Give me some more options.
Meditation therapy.
Okay, anything else?
Weight loss.
Weight loss. There are so many. You can give me a few more. And there's a little bit of lanyard. Do you remember what I said? Some of the potential benefits could be for exercise.
Weight loss.
Yeah, weight loss.
So, our last question. Have you ever misused a prescription opioid? This is also I want you to contribute to. If yes, and it's nothing that's like you're the only one, because we all have. I have as well. Do you think you have? And if yes, can you maybe provide an example of what that would be?
I would say that I probably have. I had endometriosis for many years, and the only thing I had gotten to the point to when I was taking my medication that I could drive my car, go to work, and function. And I'm taking an opioid 2-3 times a day, trying to get pain relief.
Okay, so you were taking it more than prescribed. Is that what you're saying?
Yes, because my pain level was so great,
Yes,
and
ma'am.
it would stop working, and then they had to give me something else, and that would stop working, and they could switch me back to something else, and that stopped working. And some dental surgery while all that was going on.
Okay.
And the doctor gave me medicine for pain so it could do my mouth. And it took like those for it to even work for me.
I
and
understand. I've been there.
I was driving in the car with my niece and my daughter, and I passed out in the car. And it's a good thing a car was in front of me. I was driving the standard, and my foot slipped off the clutch, and I hit a car in front of me. And they thought I was drinking and driving. I had to go to court, all kinds of stuff.
Yeah, because it's considered impairment.
Yeah, I just had to. My condition was, and what had happened that day, and I got off.
Yes,
you know, they didn't tell or give me any fines or anything. So I was blessed on that count.
Absolutely. And I'm glad you shared that. And I hope you shared that with some of your family members as a learning opportunity, because many people may not know that when you take a prescription opioid or whatever the prescription may be and it causes impairment, that is some legal ramifications for that. So thank you for sharing that, because that was a great learning lesson during this particular conversation. Next slide, please. So now let's talk about tolerance versus dependence. So opioid tolerance occurs when a person using opioids begins to experience a reduced response to medication, requiring more opioids to experience the same effect. So for this, let's give a quick example. I'm taking Norco 5, been taking it for a long time. Everything's going well. All of a sudden, I'm no longer receiving those same levels of pain relief that I've had in the past. I have to be up to Norco 10 to get those effects that I'm used to. That's tolerance. For dependence, this occurs when the body adjusts in normal functioning around regular opioid use. Unpleasant physical symptoms occur when the medication is stopped. And so essentially for this, we can use that same medication. We're taking Norco, been taking it for a long time. And the thought is that when you remove that person from Norco, they're going to get such unpleasant physical symptoms that it's going to be unbearable for the patient. That is dependence. Physical dependence does not necessarily equal addiction, but it can lead to one. Next slide. So here we talk about misuse. Opioid misuse refers to the utilization in a manner other than prescribed. So let's take a moment to look at just a few examples. You have a prescription when the doctor told you to take it once a day, and as you know, our other participants shared, perhaps your pain is not really being relieved. But instead of calling the doctor and saying that there's perhaps a concern, sometimes we will say, well, let me just go ahead and take 2. That's misuse. Or you may have received a prescription for a dental surgery that you took and you didn't use all of your medication. And then some type of other ailment happens later on down the line. You take it for that instead. That's misuse. When you take it for longer than 3 days, if that's when you were supposed to stop, and you're still taking it for 7 days or later on, that's misuse as well. And last but not least, if you loan it to a friend, that's also misuse. Roughly 21 and 29% of those prescribed opioids for chronic pain misuse them. 8 to 12% will actually develop opioid use disorder. 80% of heroin users actually first misuse prescription opioids. And it's also noted that when you do actually acquire prescriptions to use it, more than 50% of that usually comes from family or friends, so not the traditional drug dealer. Most of this misuse, unfortunately, actually getting opioids is coming from somebody that you know. Now let's take a quick pivot and look at addiction. This occurs when attempts to cut down or control use are unsuccessful, or when this results in social problems and failures to fulfill obligations, such as your work, school, or return, the things that are associated with home. Addiction often comes after the person has developed tolerance and dependence, and it makes it physically challenging to stop the use because of increasing risk of withdrawal. It's important to note that with addiction, there is no stereotypical type of person. It can happen to anyone. You can be old or young, you can be rich or poor, you can be black, white, or purple. It does not matter. It can happen to anyone. Next slide, please. So here are some signs of addiction. We have things such as uncontrollable cravings, drowsiness, changes in sleep patterns, isolation from your friends and family. You get sick often. You have a lack of hygiene. All of a sudden that has changed. And you also have weight loss. The important thing to note with addiction is that opioids trigger the release of something called endorphins that I mentioned to you earlier. Those endorphins are like a feel-good chemical. It causes euphoria. When that opioid wears off, perhaps you may still want that feeling that you had when you were on it. This is the first milestone to develop an addiction. And remember, it can happen in as little as 5 days, no matter which type of pain that you're treating. Next slide. Additional risk factors to look at. High risk environment. Do you live in an area where there may be frequent drug movement, or you live in a home with someone that uses medication or abuses it, unfortunately? That's a high risk environment. Young age plays a factor. Many youth feel like they're going to live forever, and they are more prone to riskier behavior. Unemployment is a factor because you never know that something's going to happen until perhaps your back has been pushed up against the wall. That's a risk factor. Substance abuse history, as well as heavy tobacco use. Everyone knows of all the dangers of using heavy tobacco, yet people still use tobacco. So some would say if you're willing to take the risk of using tobacco, you may be just as likely to do that with opioids. Stress is a factor, as well as mental health disorders. People addicted to drugs are roughly twice as likely to suffer from mood and anxiety disorders, with the reverse also being true. There's a relationship between chronic pain and mental health disorders that has been established to be bidirectional. So essentially when one goes up, the other goes up. People with untreated mental health disorders are more likely to have more severe pain. That is why the CDC recommends that when you're treating someone for chronic pain, that you also screen them for mental health disorders. Next slide. Here are some other important facts about opioid overdose. It comes from excessive unopposed stimulation of those receptors in your body that receives the opioids. It can be both fatal and non-fatal. The rates, unfortunately, are increasing. We're seeing a steady increase in our overdose, unfortunately. It has both mental and physical effects. The mental effects can look like aggression or anxiety or paranoia. It requires immediate emergency care. And last but not least, it is one of the leading causes of injury-related deaths in the United States. And I want you to focus on that term, injury-related. Because traditionally with injury-related, that means it's something that's preventable. So if it's preventable, we should all be doing our portion and trying to make sure it's not happening. Next slide, please. Here are some just quick signs of opioid overdose. You have your pinpoint pupils, slow, shallow breathing, a limp body, that choking or gurgling sound people say is a sound of death, pale, blue, or cold skin, as well as loss of consciousness. Next slide. So why is there a rise in overdose and misuse? There are so many reasons why. Let's start with misunderstanding between the patient and the provider. I do recognize that when you go and see your provider for an ailment, that you may sit there for like an hour or so, sometimes an hour and a half. And so by the time the doctors comes in, it feels like you're rushed because they're only in there maybe 15 or 20 minutes, and you start rattling off all of this information that you're trying to attain or soak in. And sometimes the message may be missed. Your input may actually be different from the output that they desire. So this is a time when you need to make sure there's a proper understanding. Individuals may divert for financial gain. It'll happen before you know it. There are lots of times when you say that person will never do that. You don't know what you would do when your back is up against the wall. I lived through that personally when I managed some pharmacists in the past. I had a staff member that actually diverted some things. And I remember saying to one of my supervisors, they would never do that. And my supervisor said just that. You don't know what a person will do when their circumstances change. Unauthorized self-medication for pain, such as sleep disorders. You sometimes may have problems with going to sleep at night. And you know that you have this medication at your house that is supposedly reported to cause drowsiness. That is misuse. Combine use with other sedating medications. You should not be combining your medication with alcohol at no time whatsoever. Other sedatives such as hypnotics, such as Ambien, that's an example, as well as benzodiazepines, or what some people refer to as nerve pills. Don't mix your medicine with alcohol. I'm sure you've seen on the news the things that happen when that happens. Per CDC, more than half of those that misuse opioids also binge drink. Prescribing outside of guidelines can lead to overdose. Mental health disorders. Other underlying illnesses such as heart problems, obesity, and respiratory illness. Unintentional exposure can lead to misuse. And last but not least, there's a need for honest conversation and education. This is so important. We have to have conversations like these to make sure we are educating others and we have a platform to speak when we have concerns. Next slide. So here we take a look at our available opioid overdose countermeasures. And there are quite a few of them, but on this slide, we look at the two most prevalent ones or most used ones at this time. So over time, you've had traditional injection, which is where you just draw it up and administer it from a syringe. Evizio, which is over on the right side of the purple, it can be used through your clothes and it's voice activated. The only concern with Evizio is that it can sometimes be cost prohibitive. There's an old-fashioned intranasal version that kind of looks like a syringe. You had a cone or a cylinder that you screwed on the end and you would actually insert it in your nose. And last but not least, there's Narcan. This is a ready-to-use nasal spray that most of us know about. It's most common, it's needle-free, and depending on your insurance coverage, most likely it is covered on your formulary. Next slide. So Naloxone reverses overdoses, of course. It is an opioid antagonist, meaning it binds to blocks the effects of opioids. So it does not cause any euphoria and it does not alleviate pain. It is not addictive. It is safe to use. No RX is required because of something called a standing order. You can go to any pharmacy in the state of Louisiana and ask for Narcan. And as long as they have it in stock, you can get it. You can also get it from some places such as some clinics may have it. Some of your community health organizations in your region, as well as something called an OPOC that you may hear about later on today as a resource. Check your expiration date. It traditionally lasts for about 18 months. And this is important because you may get it, have it at home for that time when you need it, but you may not have an emergency for a long time. And what you don't want to happen when it's time for you to use it, it's expired and you don't get the full effects. Remember to call 911. The health emergency or the emergency doesn't end just because you have administered the spray. Call 911 because unfortunately the event is not over yet. It works in a matter of minutes and sometimes multiple doses may be required because depending on which medication was used and the strength and how much, it may not take effect from the first time. And it's also important to know if you do have to have a second dose, you need a new container. Next slide. And so here we talk about naloxone having strong affinity. And that just simply means that you have opioids traditionally, and there are some mixed acting ones, for the most part, they're opioid agonists. So they go and attach to those receptors in your body. In comes naloxone. It has such a strong affinity that it knocks those opioids off the receptors. It can cause sudden withdrawal because of that, because it happens and it has that strong affinity. And that's things like agitation, hypertension, fever and sweating, and violent behavior. It works for about 30 to 90 minutes, and it does not prevent deaths caused by cocaine, benzodiazepines, or alcohol. Next slide, please. So here we just take a visual representation or a look of what I just told you about that strong affinity. And a lot of times it just helps you to absorb something better when you see it in a visual format. Those are the receptors that I spoke of, like your mu, delta, and kappa receptors that your opioids attached to. That's those in green, kind of like buried down in that sand. Then in comes the opioid and attaches to that receptor, and it starts exhibiting of the effects associated with opioids. When you have an overdose and you take naloxone, in comes naloxone and it knocks those pink balls off the receptor and takes its place. So it reverses all of those emergencies for a short period of time, at least with hopes of you getting emergency medical care from calling 911. Next slide, please. So now it's time for a little bit more audience participation. We're going to have another bit of knowledge check. And this is to review the last subset of information that was done. And please, as I asked you earlier, please participate because I want to make sure that you are taking in the things that I'm telling to you at this time. Next slide. So number one, and remember you can unmute yourself and just answer out. It's this very intimate platform. Does naloxone require a prescription?
No.
No.
Okay.
No.
List one place where you should be able to get naloxone or information on how to obtain.
Pharmacy, FQHC clinic.
Good deal. Can naloxone reverse an overdose caused by alcohol or cocaine?
No.
No.
Okay. Will naloxone hurt any individual if administered to them and they don't actually need it?
No.
No. No.
What should you do immediately once naloxone is dispensed?
Call 911.
You got it. All right, next slide. So we're almost there. We're going to take a moment to talk about proper storage and disposal. Store medication in a cool, dry place. Make sure you secure it in a storage box, kind of like on the upper shelf away from other things, not other things, but other people actually. Discard your unused medication. Proper discarding is key because it reduces the risk of accidental poisoning, misuse, and overdose. Proper disposal saves lives and it protects the environment. Per FDA, 90% of those patients that are prescribed prescriptions actually don't finish them. 80% of opioid emergencies from overdose are actually deemed to be accidental. And there are various methods of disposal that can be used. Kitty litter, coffee grinds, commercially available products such as Dispose RX. You can get those from like any pharmacy. That's not the only option. I'm not advocating for it. I'm just saying it's one of many. There's also approved flush lists, as well as national take back days twice a year in the spring and fall. Next slide. And this is just a visual representation of what you're going to do when you toss that medication if you decide to do it with those undesirable substances. You don't have to crush or break the capsule. Just go ahead and mix it in that undesirable substance, such as coffee litter or coffee grinds. Mix it up very well. And then you're going to take that mixture and place it in a container, sealed up, and then put it in your receptacle at your house. After that, and all of that portion is done, take care to scratch out your HIPAA off the bottle before throwing that away, because that's something that's also important, protecting your health information. So follow all those steps for proper disposal if you're going to take the measures at home that you already have. Next slide. Here we have a list of approved medications for flushing. And as you can see, it's quite a bit of them. We have things like fentanyl, diazepam, pyridine, methadone, there's quite a few of them. Now, I don't advocate you going straight to flushing. If you have options that are biodegradable, such as Dispose RX or your coffee litter that doesn't really have a potential to hurt the environment, use those or utilize those drug take-back days. But if you cannot, then of course, this is a great option because we want to decrease those chances for misuse. The FDA believes that the risk of harm for doing this particular route outweighs the risk to the environment. Next slide, please. So now we're going to briefly talk about stigmas and how they affect patients as well as doctors, believe it or not. This stigma is a funny thing because it's almost essential that someone, not you, but someone may think you know all it is to know about what that person is going through and what type of person that person is, because they unfortunately are dealing with opioid use disorder. And the reality is you don't. And from the patient standpoint, it can be a problem with respect and integrity. You feel like people are telling you that you're lying. Remember, I told you earlier that according to the definition for pain, it is a personal experience. So don't make them feel like they're lying, because that helps them with their integrity. It comes with a certain level of shame that you even have to use the medication. It can affect their housing, unfortunately. It may be predetermined just by knowing, unfortunately, their HIPAA information that they are suffering with opioid use disorder. You may think that they're unable to meet their obligations as regards to paying their rent. There's a perception of weakness that surely you can overcome this, because I know if it was me, I could, so why can't you? There are barriers to OUD treatment in regards to access to it, as well as different services. Unfortunately, in some areas, it may be frowned upon to use things such as syringe service programs, because you think that that may contribute to risky behavior. So those are also stigmas. And last but not least, as it relates to the patient, there's a difficulty in filling prescriptions. You may go in with a very true and legitimate prescription to the pharmacy counter, and you are told that they cannot fill it, and you don't understand why. So now you find yourself going from pharmacy to pharmacy to pharmacy, trying to fill a prescription. And what I want you to know from this standpoint, it is very important for you to establish a relationship with the pharmacist and make it that your local pharmacy, because they know who you are and you're less likely to have those problems. Now let's look at the flip side as regards to doctors. Doctors have problems because their colleagues think they're running a prescription mill, and they actually may not be. They may actually be trying to do the right thing, and they're worried about what their peers may think. Regulatory boards and oversight, sometimes it may be felt like it's a little bit too much, and it's actually not. It's just that we need to understand the proper expectations and allow providers to actually practice the art of medicine, as some people call it. Over referral. So with those doctors, when it comes fear of actually doing the right thing, you will see that they will often refer patients to other doctors because they're not comfortable with doing it themselves. So now this over referral causing more stigma for the patient. Inappropriate prescribing. So this refers to not giving enough or the appropriate dosage. A person may actually have chronic pain and you're not treating them at an appropriate dosage. And the reality is, when it comes to acute pain, if you're not treating it appropriately, it can lead to chronic pain. And last but not least, a fear of litigation. You're worried that when you actually do treat the patient, you're going to get sued. So all these lead into stigma. Next slide. And so here we talk about the effects on the family. So as it relates to pregnancy, you can have something called NOWS, which is NOWS, neonatal opioid withdrawal syndrome. When it comes to financial problems, it can cause a person to lose their job. In regards to your children, it can hit them with their school performance. They can be hungry. They can have hygiene issues. And last but not least, it may cause them to be in foster care agencies because they've lost both of their parents. Your quality of life is hit in reference to your range of motion and your abilities. Isolation can happen, and this is unfortunate because isolation can cause you to use opioids, and then when you're using it, you isolate yourself from your family. And also incarceration. This will happen sometimes because sometimes it actually has been an illegal activity. But the important takeaway from this is, if incarceration has to happen, you need to make sure you educate that person also. And last but not least, a decrease in mental well-being. And this can look like depression or changes in mood. Next slide. So questions to ask your doctor or your pharmacist. Verify your diagnosis. What am I here for? What are we treating? What type of medication? Is it an opioid or is it a non-opioid? The dosing schedule. Am I taking it once a day or twice a day? Your time frame. Should it last 3 days or 7 days, or how long? Most important thing, what's the expected expectation? This is so important because you don't want to leave there thinking that your goal is to be healed, when in actuality, you may have a neuropathic pain or maladaptive, and your goal is to focus on functioning and self-management. Know what the expectation is, because that is with proper prescribing. Are there any side effects or any contraindications with other medications that I'm taking? Are there any available non-pharmaceutical or non-opioid options? Ask your pharmacist that when you pick up your prescription, or even your doctor. What are my disposal options for the medication? And last but not least, is naloxone recommended? And if so, how do I use it? And how do I recognize signs of overdose? Next slide. So here you have some resources available for you in the event you need some assistance with use disorder. They are just a phone call or a click away. You can go to ldh.la.gov. You can also place a phone call to SAMHSA, which is a national organization. You have LA 211 as well as VLink. These are anonymous services that can be used by anyone, especially youth, because it does happen to them, and they find it to be good because they have text services to where they can just give you automatic replies on what to do next. And last but not least, Region 7 services, and just a few randomly selected places that are in Region 7 with their phone numbers that can be reached out to. Next slide. And that concludes my presentation. And at this time, I'm going to hand you back over to the library to either Miss Heather or Miss Yolanda. Thank you.
Thank you,
Thank you
Natasha.
so
We really
much,
appreciate
Natasha.
your presentation.
That was great, Natasha. Thank you so much information. I know I learned a lot. So we have a few minutes. We'd like to open it up for some questions. So feel free to unmute yourself so you can ask your question, or you can type your question in the chat.
Now, don't be afraid to ask questions. We're here. It's a safe platform. And it's not often that you just get to have questions and just have a pharmacist at your disposal for free. So if you have some questions, we're more than happy to answer them.
I know that I found it incredibly helpful to think about all of the ways that it is considered misuse, because I think that that's something that we've all done and just haven't really given it a second thought. I know for me, for example, I had several years ago, I had surgery and they had given me some pain medication after the surgery for recovery, and I didn't use it all. And then probably a few months later, I was just having a really, really bad time with sleep, insomnia. I was having like terrible insomnia, which is not something that I normally struggle with. And I do remember distinctively one night in a fit of desperation being like, I'm going to take a pill. And I did, because it like made me go to sleep. And, you know, I realized it at the time that that's not what it was for. But in my mind, I was like, oh, it's harmless. I've taken it for other things. And and I know that it does make me sleepy, but that's not a good attitude to have, because it's real easy just to go from that point to
taking it all the time for your sleep. But guess what? That is so common for so many people. I have a person in my immediate family, not in my household, but in my immediate family. She's a healthcare provider, very well respected nurses, if you must know. But from her standpoint, number one, medication doesn't expire. And you never dispose of anything. Keep it forever, because you never know, as she says, when you're going to have a rainy day and you can't get to the doctor. And she is a very well respected health nurse, might I add. But it happens. People do it. It's more common. It's more often than not. And so you have to just make sure you get the message out there and be responsible with it and tell them what you've learned thus far.
Excuse me. I just wanted to mention, something about the Narcan, just giving people Narcan. I want you to tell the people, actually, I want to say one of the main things you want to do when you give Narcan to people is be very careful. It's not like you see on TV where you give it to them and they're just going to wake up and be okay. 9 times out of 10, when they wake up, they're mad. They're in like 2 or 3 days withdrawal. So they're ready to fight. So be prepared for that, as well as, them being mad at you because you just, they're high and their money.
Absolutely. So, I mean, I guess, there's so many layers to that. But at the end of the day, you have to think that you're doing the right thing morally. And so, yes, it does come with a lot of agitation. That's why they tell you to put them in that rescue position, because it's most likely going to happen. That's why it's also important to call 911, because depending on how severe that withdrawal symptom may be and what it was, they may go through those rough days in the hospital instead of at home mad at you. So make sure you call 911. And then I know that they may even get upset with you about calling 911, because a lot of people, be upset about the transport bill. But at the end of the day, it's better to do all of those things than take the risk of that person dying.
Correct.
Thank you for talking about proper disposal too, because I have a lot of unused medication, after dental procedures, I've had surgeries, after having my kids, and I always end up missing the National Take Back Day. So I just have it stored, and I never know what to do with it. So it's just sitting in there. So that was very helpful to know that we can use kitty litter and coffee grounds and all that.
You definitely can. And you can even go into a local pharmacy. Like I said, I know a lot of the big box chains have their preferred method of whatever their substance may be, but essentially it's a little small packet. You pour it in your bottle and you add water, shake it up, and it makes it biodegradable. And you just go ahead and throw it away.
I had no idea. Thank you.
You're welcome.
Just thank you for the presentation. I enjoyed it.
Thank you.
It's kind of makes you think a little bit more about what we do every day. Thank you.
You're welcome.
Well, we're out of time. So I want to thank you again, Natasha. That was a fantastic presentation. And I want to thank everybody for attending. I do want to remind everybody that there will be a recording of the session on our website at bosierlibrary.org/community-conversations. And we hope to see you all next week at our next session.
All right. Thank you for having me.
Thank you.
Thank you.